Hello everyone and welcome to Module 1 of Fundamentals of Clinical Laboratory Techniques. This week we are focusing on medical assisting and professionalism. So with that being said, we are going to focus on 3 chapters for this week: Chapter 1, Chapter 2, and Chapter 59. Now in these videos I will go over specific parts of them, touch briefly on information that will be important for you, but it is still your responsibility to fully read each chapter. These chapters this week are not very long, so please make sure you take the time to read each chapter. It will help you with your discussion boards, future assignments, and quizzes. So let's get started. Let's talk about Chapter 1. And Chapter 1 is medical assisting and the profession itself. Now, medical assisting really evolved or developed due to rapid changes in the healthcare field. Oftentimes, medical assistants are referred to as the jack of all trades. Now, this is because we do have a wide variety of tasks that we can perform and that we can be responsible for. Once upon a time, the medical assistant used to be trained by the provider, but now a formal training is required, which is why you're going through this program here at Rasmussen. Now, just because you do go through the formal training, you still work under what we call the physician's license. That means that your physician that you work for is responsible for the actions that you perform. Now, because this formal training was needed, the American Medical Association of Medical Assistants, or the AAMA, was created and formed in 1955. This helped to provide that formal training that was needed. Now, in order to receive that formal training and certification, a program that you enter into must be accredited through one of 2 programs, either the Commission of Accreditation of Allied Health Education Programs, or CAHEP, or the Accrediting Bureau of Health Education Schools, or ABHES. Here at Rasmussen, we are accredited through the ABHES program. So once you get into your fields and you start applying for jobs that will be asked of you, you will know that you are accredited through ABHES. Now, the AAMA is a national certifying agency with its headquarters in Chicago, Illinois. They offer the Certified Medical Assistant, or the CMA certification, which is really what you're striving for and that what you should receive at the end of this program, pending the exam that you take at the end. Now, once you do become certified, there are some rules that you do need to follow. The first rule is that you need to complete 60 continuing education units, or CEUs, in a 60-month time frame, or 5 years. If that does not happen, you have to complete the 60 CEUs and retake the certification exam. That is not something that you want to do, so I highly suggest that once you get into your careers, you get settled, you start working full-time, start doing those CEUs. You need to have at least 12 a year in order to meet that 60 CEU requirement. Now, once you do become certified, you can work in one of 2 capacities. You could work as a clinical medical assistant or an administrative medical assistant. Let's take a look at what the difference is between those 2. So an administrative medical assistant is the one who we consider the front-end medical assistant. They will schedule your patients, greet them as they come in, arrive them for doctor appointments. They'll deal with the mail that comes into the clinic, the billing pieces. They will also deal with taking co-payments, maybe doing collections. They'll also handle any of the billing for the office. So they have a wide range, but they're the ones that are mainly in the front of the office. Where a clinical medical assistant is more of the back-end medical assistant. They are there to help the provider have a better experience with their patient. We do this through obtaining medical histories, performing certain CLIA waived or clinical lab tests, assisting the physician during procedures or exams. We handle doing inventory as well as administering medications or immunizations, and cleaning and sterilizing our instruments after being used. That's where I'm going to stop for Chapter 1. Let's move on to Chapter 2, which is dealing with the medical science and the history of medicine. So medicine has been in existence for as long as there have been disorders, injuries, or illnesses that affect human beings. The first set of doctors that were ever around were considered what we call medicine men. These were men that were also considered shamans, witch doctors, and sorcerers. One of the first important men that was ever known was a man named Hippocrates. Hippocrates is known as the father of Western medicine. Now the chapter does go on to discuss other important figures in men like Galileo, Ben Franklin, Louis Pasteur, and other men. But beyond them, there were some very important women in the history of medicine as well. Individuals like Clara Barton, Florence Nightingale, and Elizabeth Blackwell. I'm going to leave those individuals for you to read about. So please make sure, again, that you are reading Chapter 2 as it does discuss those important individuals. Now, Chapter 2 does go on to talk about healthcare professionals or allied health professionals, which medical assistants fall under that title. But before we consider some specific professions, you really need to know and understand three very important terms. The terms certification, licensure, and registration. A certification involves the issuing of a certificate and credentials by a professional organization to one individual who has met the educational and experience standards of an organization. For example, your certified medical assistant. You will receive a certification at the end of this. A licensure, on the other hand, means that a government agency authorizes individuals to work in a given occupation. For example, licensed practical nurses or physical therapists. They have a government license that says they can work in that field. Lastly, you have your registration, which means that a professional organization in a specific healthcare field administers exams and maintains a list of qualified individuals. While there's nothing wrong with being a registered medical assistant, you want to strive for something higher, because each year you'll have to re-register in order to stay active on that list. All right, that's going to end Chapter 2. Moving on to our final chapter, which is Chapter 59. Now, this chapter is specifically talking about professionalism and how to act in a professional manner. Healthcare professionals need to have good technical skills and soft skills. Soft skills are those that are necessary for the smooth functioning of your office. And another important skill is your affective skills. Now, these are behaviors that come from your feelings or your emotions and are truly important to the office. Most commonly, it affects your attitude and how you actually perceive and act in that way. Beyond having the skills listed here, some other very important skills that you must possess are teamwork, being a team player, showing initiative and jumping in and helping others out, being a proactive and being a self-starter. That's very important. Knowing how to manage priorities and having good time management. Very important for how an office runs. Being persistent, which means don't give up when others do. If you know that the end result has not been met, keep fighting, keep pushing forward. Along with having those good skills, you need to have what we call a professional image. So regardless of if it's in school or you are in an office, you need to have a good image. Making sure your hair is tied back, watching your hygiene, having a good attitude, no tattoos showing, no excessive piercings, no strong perfumes, no dangling or excessive jewelry. All of the things that we look at when we talk about your path assessment, that professionalism, attitude, time management, and hygiene. Last thing I want to talk about is communication. This can be anything that happens either verbally or non-verbally, written or spoken. Maybe it's you're emailing or you're meeting with a patient, watching your body language, knowing how to use professional language when you speak and when you write. This isn't your best friend from high school. You need to make sure that every language that you use, everything that you write, is actually in an appropriate professional language. When you're speaking with people, actively listen to them. Don't just listen to respond. Listen to hear what they're actually saying. Speak so that you can be understood, enunciating certain words, making sure that you don't have any candy or gum in your mouth so that way you can actually speak clearly. And seek to be understood. Make sure that the patient understands what you're saying to them in order to get the best response back. All right, to wrap up this video, I wanted to give you what your assignments are for the week. First and foremost, you do have your first initial discussion post, which is dealing with professionalism in the workplace. Now, this week only, your initial discussion post will be due on Wednesday, January 4th by midnight. All other weeks moving forward, your initial discussion post will be due on Tuesdays. But because of this week and we started one day late, we gave you an extra day to work on your discussion board. So please, again, make sure that is completed Wednesday, January 4th by midnight. Just your initial discussion post. Second thing you'll need to do is complete at least one reply post to a classmate no later than Saturday, January 7th by midnight. If you do respond to me as your instructor, that's fantastic, and I do encourage it, but it does not count for your grade. And the last thing that you have this week is you do have your first quiz. Your quiz is all multiple choice true-false questions. There are 28 questions in total, and you do have a set time limit. Please make sure that you are reviewing your course calendar for any information about due dates, time limits, and things of that nature. Now, your first quiz on professionalism and boundaries will be due no later than Sunday, January 8th by midnight. If you have any questions, comments, concerns, or fears, please make sure that you're reaching out to me either via email or via course messaging. You can also call me directly on my line at campus, which can be found under the instructor info on the course home page. I'm available 24/7, so please don't feel that you're bothering me or you're intruding on any time. If you have questions, please make sure that you're bringing them to me. And I hope you all have a wonderful start to a new quarter here at Rasmussen College. Bye, everybody.